that time of year where people want to get rid of brown spots and redness on their face. And the way we do that is with a treatment called a photofacial. It actually has another name in our industry, and that is called IPL, which stands for Intense Pulse Light. This is not a laser treatment, it's a cousin to laser, but it does a really great job in helping get rid of those excess browns or reds. How's it done? You come in, we cover your eyes with protective eyewear, and you have this treatment. It can be done well on the upper body. It can work on the lower body, but it's really great for the face, neck, chest, arms, and hands. It is equally great for men as it is for women. Uneven skin tones make people look older than they are, and when we get rid of all that excess discolorations, the skin looks smoother, it looks healthier. What happens when you have this treatment? If you're coming in for browns, the day after those browns come to the surface and they're darker and they're actually a little bit rough in texture, scabbish. And it takes on the face about 5 to 7 days for those to slough off. When we go on the neck, chest, arms, and hands, it can take 3 weeks. So we actually do tend to wait for the fall to do these treatments because you can cover up if it doesn't look good. How many treatments do you need? Most companies will tell you 4 to 6. We have the device that seems to be the most effective out there. It's made by Cynosure. It also was known as Palomar, but we find in 1 or 2 treatments most of our patients are done, so it's really a lot more cost effective. Let's talk about reds. When you have a lot of redness in your skin, that's a lot of capillaries that grow close to the surface. Sometimes it can also be called rosacea. People of Northern European descent seem to have more of this than darker skinned people. That is also helped, although it does take more than 1 treatment to knock out those reds. The thing about the redness, when we're treating the midface for a lot of reds, you could expect to swell, and that swelling will stick around for a couple of days. We don't see it as much when people just need to be treated with browns. So when you come in for a consultation, we'll talk to you about that process and what we think you can expect. People with a lot of reds can even bruise. But at the end of the day, when this thing is all done with its healing process, people love their skin that appears more uniform in color. The last thing I'll tell you is a physician recently presented at a conference patients that he treated annually every year for 20 years, and they aged at an incredibly slower rate than the average person. So it is a preventative treatment as well.